And even as much as having information data on language and preservation and taking it back to my tribal leaders so they'll know the importance of having our cultural elders and our cultural teachers in our classrooms to be able to preserve and protect our culture and our language.
The number one use that I find is sharing with your staff. Our early childhood staff are professionals. They need to know the importance of the work that they do and how each day that they interact with children and families and with each other, they are contributing to what can happen next for our children and families and to support them in their profession. I'd say that the data that I've most been drawn to is the focus on culture and culture in the lives of our children and families. It really drove our need to focus more on our cultural curriculum. We saw data that showed that it was important for most families and that most families had opportunities to interact in cultural events, but that there was that missing piece of children being immersed. Not many of us have fluent speakers. And so the data gives you the opportunity to say to funders outside of federal Head Start and early Head Start that we really need to support families and children in a greater depth in the work around bringing language and cultural practice back.
Our program uses the information locally to improve services, improve program quality, and also to improve child and family outcomes. The results can be used in various ways to examine, for example, the relationships between program characteristics, classroom quality, and child outcomes.
From the variety of statistical information, such as any type of health disparities that we see among Indian country, and especially in Region 11, that information really helps me plan in terms of working with community partners like IHS, realizing the importance of Indian Health Service in the lives of our children that we serve, and making sure that we have them at the table to let them know how important it is that our children have medical homes, get current vaccinations, receive the services that they need from the dental clinic in order to give them a more robust, healthier experience at our Head Start program and beyond.
You look at the AIAN FACES data as opportunities when you are doing other work with your state and local meetings and advocates, that you bring up what you know and the more questions that you have to ask. And the more questions that you ask, the more opportunities that you can provide or follow in the journey towards all of us improving services for AIN children, families, and supporting our staff in the programs across the country.